Catch a health problem before it gets serious, and it could save your life. A new digital diagnostic tool may be doing just that. Kelly Mack is here now with a survivor story. Kelly?
Well, Chuck, you may have heard us mention HealthView before. It's a tunnel-like machine that scans up and down your body for signs of disease. We found another success story that we just had to tell you about. She's a 20-year veteran of the LAPD. She's the department's first female commanding officer, its top recruiter, and...
I'm a HealthView zealot. That's what everyone calls me. I call myself a HealthView zealot. I carry these little pamphlets around with me everywhere.
Commander Betty Kellepez is talking about a groundbreaking technology that she says saved her life.
This is your liver.
It's HealthView in Newport Beach, in the office of Dr. Harvey Eisenberg. A super-fast CT scan takes 3D images of your entire torso.
This is a concept of preventive medicine which begins with the ability to detect a variety of diseases at much earlier stages than other technologies currently can.
So my concern is, how are we going to put into this?
Commander Kellepez felt fine, but she was worried about heart disease.
My father has a bad heart, and I had been worried about my heart for some time, and he had had a six-way bypass when he was not much older than I am.
The scan found no plaque in her heart's arteries, but it did discover a mass on her right kidney. Betty saw several specialists, then learned the worst.
Renal cell carcinoma, or kidney cancer.
But the scan detected the disease at such an early stage that doctors were able to remove Betty's kidney and declare her cancer-free. They told her if they hadn't caught it early,
I would have had a 5 to 15% chance of living beyond 5 years.
These days, Betty not only recruits LAPD officers, she recruits her colleagues to go for a HealthView scan.
It comes up frequently in meetings.
Betty says she joined the LAPD to make a difference, to save lives.
I never anticipated that I would be saving lives by being a survivor of cancer myself. And quite frankly, I owe HealthView my life.
Well, Betty says the scan does not make you feel claustrophobic. I took the scan myself about 2 years ago, and I can tell you that the tunnel is much larger than other types of scanning machines like the MRI, and you only have to stay in there for 10 minutes at the most, unlike an MRI. Chuck and Michelle, back to you.
Oh, that is really something. Thanks, Kelly, and that'll wrap it up for us here on the news at 4 o'clock.
NBC4, the station working for you. Chuck Henry, Kelly Mack, Fritz Coleman AccuWeather, Fred Rogan Sports, Southern California's #1 news, the Channel 4 News at 6.
A new medical technology being used in Newport Beach is changing the way many doctors are diagnosing their patients. It's called HealthView. Take a look. As Dr. Gordon Gunn prepared to undergo the HealthView scan, he figured the test would show that he was perfectly healthy. The Fullerton gynecologist felt great, exercised regularly, didn't smoke, his blood pressure and cholesterol levels were normal. But what the test detected was this: serious cardiovascular disease.
Shocked. Absolutely taken aback. I meet all the criteria for virtually no risk factors. So that's why I was really surprised when I saw the degree of plaque that was present.
So you can see the plaque there. And
Dr. Harvey Eisenberg, who developed the HealthView technology, tested 150 physicians who seemed to be in great health.
At least 1 out of 4 had significant coronary artery disease, significantly above what we would find in the population of their age groups. Tumors. Most of them were benign, but some were malignant. 85% of them had back problems of some sort.
Dr. Eugene Levin went through the test and discovered not only back problems, but an enlarged prostate gland and plaques in the heart.
That night I went home and started treatment in a vigorous way, which was to stop the donuts, watch my fat, and I got on an anti-lipid lowering drug.
That so many physicians would not have a clue about their own serious health risks does not surprise Dr. Eisenberg.
We see people with pancreatic tumors the size of a grapefruit or renal masses who are totally asymptomatic, who just had their normal physical examination.
But perhaps more exciting than the ability to diagnose problems early is the way this technology motivates people to change unhealthy habits.
My cholesterol has been halved. It went from 280 to 180.
So it's a quantum leap in terms of really getting your attention.
The HealthView technology available through Dr. Harvey Eisenberg in Newport Beach costs about $600, but many insurance plans, including Medicare, will pay for it. The wait for an appointment is very long, though, about 3 to 4 months. So if you call, be patient.
You first did that story many months ago.
This is KTLA News at 10.
In health news tonight, heart disease will kill more people this year than cancer, and more women than men will die of heart disease. But now a new non-invasive test can predict your chances of developing heart disease at a young age. The machine looks imposing. It's an electron beam CT scanner, basically a CT scanner with no moving parts, which allows physicians to get a very rapid and clear image of the heart with no movement. When calcium deposits are discovered, arteriosclerosis, or hardening of the arteries, is present.
The beauty of this test is it allows you to really define, do I have it, or do I just have the risk factors? Once people know they have the disease, they behave a little differently.
Even though the test is non-invasive, I realized I was pretty nervous when it was pointed out to me that my heart rate was well over 100 beats per minute. My heart rate settled down, the test took only 2 minutes and was painless. The toughest part is holding your breath for the short time while the picture is taken. The results are practically instantaneous.
You've got no calcification in your coronary artery.
Yes. I was more relieved than I expected to find I have no signs of early heart disease. However, when disease is detected, as with this patient who shows small calcium deposits, there are steps that can be taken immediately. The good news is that handled properly, heart disease does not have to be deadly. Can you stop the progression of heart disease?
Absolutely. You not only stop it, but you can reverse it if you become aggressive enough in working on it. There's been a number of clear-cut studies that have demonstrated that with the right kind of diet, medications, exercise, stress management, you can actually start to reverse the coronary process, make it disappear at the rate of 6 or 8 or 10% a year.
Although I was fortunate to have a negative result, I would still have wanted to know where I stood in terms of heart disease because both my parents died of heart disease. Early detection means being able to make a real lifestyle change. This test is beneficial for anyone, but particularly for men over 35 and women over 40 who have risk factors, including high blood pressure, family history, diabetes, and smoking, among others.
Next, a medical breakthrough helps doctors keep a close eye on your heart.
A major advance in our ability to detect coronary artery disease.
Heart disease is the #1 killer in the U.S. Unfortunately, for many, the first sign is a fatal heart attack. Traditionally, methods of diagnosis for heart disease have involved some pretty invasive procedures. Now, a California medical company has taken a page right out of the mammogram guidebook and developed a way to diagnose heart disease without putting someone under the knife.
It comes without warning, on a day just like any other day. First, you feel a slight tingle in your left arm, and there's a sudden shortness of breath. It's a shocking moment in time that you'll want to take back for the rest of your life. You realize you're having a heart attack.
In 1999, there will be 650,000 individuals who will have a heart attack with no prior symptom of coronary artery disease. 150,000 of that 650,000 will never get a second chance. Their first introduction to coronary artery disease is a fatal heart attack.
I found out about 15 years ago that I had the potential for cardiac disease because my mother had bypass surgery when she was 54, and her brother and sister all had bypass surgery in their early 50s.
Hey, we're going to do a CAT scan.
Donna Klauenberch is a person with many of the symptoms typical of someone at risk for heart disease. Until recently, her only real alternative for an accurate diagnosis of the condition of her heart was an invasive procedure called an angiogram. A machine called the electron beam CT scanner from a company called Imatron has given her an opportunity to assess the condition of her heart without surgery.
This machine has been determined by medical research to be 10 to 15 times more predictive than any combination of risk factors that can be measured.
Risk factors are often measured by non-invasive treadmill tests. However, these tests will only detect a disease that is fairly advanced.
I've probably done the treadmill 3 times, and each time it has shown that I didn't have problems, but I've heard that you have to have 75% blockage before a treadmill will pick that up.
That's a limitation of all of the traditional non-invasive tests. They all require that the disease be clinically inducible or manifest before they're abnormal.
Like a mammogram, the electron beam CT scanner by Imatron scans a patient's heart for calcium deposits, a sure sign of heart disease.
The Imatron ultrafast CT scanner is analogous to a very large television tube. In fact, it's the world's biggest X-ray tube. Electrons are generated here at the electron source and are then accelerated down this tube, and in this section here, this very intense electron beam is bent and focused on an X-ray target, and the beam is swept completely around the patient, and when the beam hits the target, a fan of X-rays is created that sweeps around this patient, and of course, because the electron beam has virtually no weight, this sweeping motion can be accomplished very rapidly, one sweep, one scan.
As an early diagnostic tool, the electron beam CT scanner might give doctors and patients early warnings of heart disease in time to aggressively treat it.
The electron beam CT scan is clearly superior to anything else that we have and represents a major advance in our ability to detect coronary artery disease.
For patients who have risk factors in their life but don't have advanced symptoms, this scanner might help avoid unnecessary surgical procedures.
I found out that everything looked wonderful and that there was no signs of calcification and everything looked really healthy. So I'm thrilled.
In the future, diagnosis of heart disease may become a routine part of a checkup, and fewer people will experience a heart attack as the first and last sign of heart disease.
When you consider that coronary disease in particular and cardiovascular disease in general ranks among the #1 causes of death in the United States, I think that an effective screening tool for the presence of coronary artery disease is long overdue.
That's Nightly News for this Thursday. Tomorrow night, is there any way to know if you're headed for a heart attack? Well, it turns out a new, inexpensive test could save your life, and we'll show you how. I'm Tom Brokaw, and I'll see you back here tomorrow night.
Is there any way to know if you're headed for a heart attack? For thousands, the first sign of trouble is fatal. Now, a new, inexpensive procedure could save your life. NBC Nightly News tonight.
Ever younger, stopping a heart attack before it starts.
From NBC News World Headquarters in New York, this is NBC Nightly News with Tom Brokaw.
And ever younger tonight, new help for those with the potential for heart problems. A device that can give you one of the sharpest pictures ever of what's going on inside your arteries before the trouble starts. Here's NBC's Robert Hager.
It's called the ultra-fast CT scan, and if you're in your 40s or older, like Bev West or James Ferris, this new tool may be highly promising for discovering clogged arteries in time to prevent heart attacks.
Key thing about this device is how fast it fires the X-ray beams through the body. It's 10 times faster than a CAT scan. So that means the picture of the heart it gets is very, very sharp. It's not blurry, not affected by the beating of the heart or the pulse of the artery.
What it shows is explained by George Washington University's Dr. Alan Wasserman.
This patient has coronary artery disease. This is not the stage we want to find someone, showing that this artery already has calcification. This is a patient that has normal coronary artery. This is the right coronary artery coming off the aorta. It has no calcification.
Now, what does it look like when someone has a really bad block?
Well, you can see the difference here. You can see the entire artery here in the left side is calcified. This is a severe advanced stage of calcification. In fact, this patient went for bypass surgery.
Among screening tests, cholesterol checks and stress checks are cheaper but less accurate. Angiograms are most accurate but cost thousands of dollars and are invasive, involve snaking a tube through the body to the heart. Ultrafast is non-invasive, takes only 5 minutes, and costs about $400 to $500. Why then are there only 40 in service in this country? The CEO of the company that makes it.
One of the major problems in terms of distribution of these machines in the country is lack of widespread insurance reimbursement.
That's because it's new. Meantime, reassuring news for Bev West today, no signs of calcium. But James Ferris, tested earlier, did have a lot of calcium.
It was the catalyst that caused me to seek further diagnostic tests, which eventually led to my having a bypass operation last June.
Today, Ferris is healthy, and some believe this new scanner could keep many others healthy, too. With 1.5 million heart attacks in this country each year, there's a lot at stake. Robert Hager, NBC News, Washington.
Kelly Mack now has more on this medical marvel. Kelly?
Well, Chuck, it's an ultra-fast CT scan, and since we first told you about this last spring, it has saved many lives. Case in point, an Irvine woman who had a fast-growing cancer and didn't know it.
Okay, kids, you want a treat?
Even a simple task like feeding the dog seems like a miracle to Jane Getchell of Irvine. A trip to the doctor back in April, Jane says, saved her life.
If I had waited until August for my usual checkup, I would have been toast.
When Jane found a small lump in her breast last spring, she decided not to wait for her regular mammogram. Instead, she underwent a super-fast CT scan in the office of Dr. Harvey Eisenberg. This is a three-dimensional image of Jane's chest and shows a white mass in one breast.
This really stood out very easily, and it was pretty clear that this was going to be a neoplasm, a malignancy.
The technology that Dr. Eisenberg used to identify Jane's tumor is called HealthView. The respected radiologist feels it is in some ways superior to mammography as a diagnostic tool.
It doesn't matter to us how large the breasts are or how dense they are or whether implants are present. Those really don't interfere with the imaging as they do with conventional mammography, which is a two-dimensional technique.
While mammograms may not detect every cancer, Dr. Eisenberg says the mammogram is still very valuable, that it is in fact a better detector of small areas of calcium in the breast, which may indicate cancer. Jane's surgeon believes a mammogram would have revealed the tumor, but had she waited for her regular mammogram, the tumor could have been much larger.
It was a breast cancer that was relatively high grade. It had the appearance of a cancer that was actively dividing and growing.
When Jane Getchell gets ready for work in the morning, she does it with a sense of gratitude and a renewed appreciation for everything around her.
You look at trees differently, you look at life differently, and you don't put off the things that you had always wanted to do.
Yeah.
Because you never know.
Well, the ultra-fast CT scan is not yet recommended as a regular screening device for breast cancer. Doctors say women should still get mammograms on a regular basis. But as Jane found out, the HealthView technology can save lives. Chuck?
Hey, that's amazing. Thanks.